Keep going. I talked to a doctor a little while ago about the impacts this cold can have on your health because, of course, we're not, as Micah talked about it, we're not used to seeing stuff like this. So it's not just creating issues on the roadway, but it also can impact your body. So here's my conversation with that doctor.
Adon Alvarez, who is a doctor from our area. He has the Lux Primary Practice. And doctor, I know that, us Houstonians, us in Southeast Texas, not really used to this Arctic cold, and we may not think about what we're thinking about driving around and concerns that it has with our vehicle, but also there are issues when it comes to health, and we're not used to this type of weather. So first of all, let me say hello and nice to talk to you today. And tell us first, can the cold weather really cause colds?
Well, Nick, thank you for having me. So that's a very common question. Does cold weather cause colds? It does not. However, cold weather does decrease your body's ability to fight infections. And studies show that there's a 40% decrease in immune response when the nasal passages are exposed to cold air. So this makes you more likely to get an infection when you are exposed to viruses.
And tell us, if you are exposed, and you talked about how it can impact your body, so what do you do then to prevent the flu or getting a cold right now over the next few days?
So unfortunately, there's no 100% way to prevent viral illnesses. However, there are ways of decreasing your chances of getting sick. First and foremost, staying up to date on your vaccines. Vaccines help your body make memory cells to whatever you're being vaccinated against. So that way, when the actual virus comes along, your body knows what to look for and is more efficient at fighting it off. The other big way of preventing infections is by doing everything possible to boost your immune system. So that means getting a good night's rest, eating well, decreasing stress, and getting a daily dose of vitamin C have all been proven to help boost your immune system. And the last way is actually by preventing the virus from entering your nasal passages. So this is by wearing masks, hand washing, hand sanitizing, those types of things.
Does bundling up work? Does that help your body fight off getting a cold or the flu right now?
Well, so staying warm will help, especially if you try to keep your face nice and covered and warm. Yeah.
And but so I know that obviously not everyone can stay indoors today, and so we know about heat stroke or heat issues look in the summer, but when it comes to the cold, we know that it can cause hypothermia and other issues that come along with it. What are some symptoms and signs to look for with those issues?
So some of the first things that you'll experience with hypothermia is shivering, of course, cold, pale skin. You might even get some numbness and tingling in your limbs. You'll experience a decrease in breathing rate and shallow breathing, and your heart rate might even start to decrease. As hypothermia worsens, then you'll start to have more severe symptoms. So those will manifest as loss of coordination, confusion, slurred speech. So if you start to have those types of symptoms, that's when you need to seek medical attention immediately.
Is it a good idea if you're having those symptoms to just take a hot bath, get warm in your house, or can that actually make it worse?
So if you're with the first stages like shivering, the cold skin, the numbness and tingling, yeah, of course, layering up, trying to drink hot fluids like teas, coffee, will help. Avoiding alcohol, actually. Doing those types of things. Warm baths, I try to tell people not to do warm baths, not because of while you're in the bath, but when you come out, you're going to be cold. So you'll actually lose some of that, heat that you've worked so hard to get. And of course, if you have a space heater, being around the space heater or just trying to bundle up and stay in a small room. Because of course, it's a lot easier to warm up one room than it is to warm up the entire house.
And let me ask you, I went for a run this morning because I'm from the Northeast, and so it's not terrible for me. But I did get some red spots on my skin. I'm assuming it's because of this cold weather, and I'm assuming people may experience that themselves today. What do you do if that's the case?
Well, just more rewarming, right? And so you do want to be close to a heat source, but not so close that you're going to burn yourself. So if you are having issues with hypothermia, again, your limbs will go numb. So one thing that happens that sometimes people get too close to a heat source and will actually end up burning their skin. So
Okay.
that's something very important to keep in mind when you're trying to rewarm.
And at what point do you call 911?
That's more than anything whenever you're starting to get some neurologic symptoms. So like we discussed earlier, if you start to have confusion, slurred speech, problems with coordination, that's when you need to get 911 involved and go, go seek medical attention.
All right. I am talking with Dr. Adon Alvarez, who is with the Lux Primary Care. And I have his website right here as soon as I can share the screen. There we go. And doctor, let me ask you, I know that people may have chronic conditions and this may impact them differently. Talk to us about that and how this cold can impact them.
So the big thing with chronic conditions is, to try to be prepared. So making sure that you have enough medication to last you at least a week, is very important. The other thing, it really depends on what the chronic condition is. So asthma is very, very common in the area. So of course, making sure that you have your inhalers available because the cold will make asthma worse. And in severe, if your symptoms worsen to the point that where your inhaler is not working, seeking medical attention, to get on stronger medications or even steroids at times. Allergies will also be affected by the cold, so making sure you have medications like Claritin and Zyrtec on board. And the other big issue is pain. So patients with arthritis and chronic pain conditions do experience more pain when it's cold. So it is important, to make sure that you stay within your prescribed regimen for pain control.
And then what about elderly?
Uh,
What people need to know about them with the cold?
So actually, children and elderly are at greatest risk for the cold because they have a harder time regulating their core temperature. So it's this population that we really recommend that they dress in layers because that way, if they start to feel too hot, start to sweat, then you take a layer off. If you're feeling too cold, then add a layer on. And really keeping this population well hydrated with warm fluids is key.
And then what about, kids are home on Martin Luther King Day, most of the kids, and then tomorrow could be as well with the bad weather. So tell us, doctor, what should parents need to know to protect their little ones? You talk about dress and layers, but
Mhm.
just how quickly can this cold maybe impact them versus their parents?
Oh, well, again, with kids, because so kids have more surface area compared to their core body. So that's why they have a difficult time with regulating core temperature. So it is a lot easier for a child to become hypothermic versus an adult. Um, so a couple of things for parents to know also, if they are going to be driving, is leave with time, right? We've had a lot of accidents happen on the roads because of the freezing conditions. So it's leaving with time to avoid speeding. When you do dress your child, don't forget mittens, gloves, thick socks, hats. Everybody remembers the core things, but taking care of hands, feet, and your head are also very important.
Doctor, anything else you want to add when it comes to this cold weather in your health before we let you go?
Well, the biggest thing is really being prepared, right? Like we mentioned earlier, if you have chronic issues, making sure that you have your medications in case you can't make it out to the pharmacy, and of course, staying warm, making sure that that you're doing everything possible to remain as healthy as possible, so that way your immune system's working well, and your likelihood of getting any flu viruses are minimal.
Dr. Adon Alvarez, thank you so much. Stay warm yourself. And again, put up his website a little bit later or earlier, so feel free to check him out if you have any other questions. Have a nice day.
All right.